We have a very special guest joining us today with very special expertise. I'm so excited. Alyssa Morrison with Lawyers for Good Government. Welcome and thank you for all that you do.
Thank you. I'm so happy to be here.
Okay, Lawyers for Good Government. I feel we have never needed Lawyers for Good Government more, at least in the
Mhm.
recent history. And can you share with our listeners, with our audience, a little bit about what Lawyers for Good Government is and does?
Yeah, absolutely. Happy to. So Lawyers for Good Government, L4GG, we were actually started by our founder in Tracy Fightlove in 2016, in the wake of the 2016 election, based on the fact that, there were all of these lawyers who were kind of desperately asking, what can I do? Lawyers of all different day jobs who hadn't necessarily, been really engaged in civil rights previously, but desperately wanted to do something. And so we started long before I ever joined as really a Facebook group of people, throwing out opportunities to help, and opportunities for pro bono. And then, through a lot of hard work on Tracy's part and a long series of events, ended up becoming an independent nonprofit and have now grown to, I think we have like 55 or so members or staff rather. So we work in a couple of different areas. We work in, we have Project Corazon, which is our immigrants' rights team. They do incredible work. Our climate change and environmental justice team, and then our gender justice and health equity team, which is the team that I'm on. So I primarily focus on our reproductive rights work. But yeah, we do policy, advocacy, litigation, kind of education stuff, just across the spectrum.
Thank you for working on the whole spectrum, and thank you to you personally for working on reproductive rights. Hello, you
Yeah.
all. Reproductive rights are going backwards. We're in a state of reproductive wrongs.
Yeah.
We right now have not only abortion access under attack, but also birth control access under attack and basic health care access under attack. I mean, it's all under attack.
Yeah.
And I'm wondering if you can share with our listeners and our viewers just how dire the situation is. And I normally don't ask for the depressing outline, but
Sure.
this is something that is so bad and is sadly also not getting the press attention that it deserves.
Yeah, no, absolutely. And unfortunately, it is a lot of bummer news working in this area right now. But yeah, it's pretty bad. So I'm based in Texas. So we're a total ban state. We're one of, I believe, 13 states right now that have a complete gestational ban, but about half of the US states have some form of, ban prior to viability. And they all have, different exceptions in there, but in practice, those exceptions can be really challenging for clinicians. And I think we've all seen, the horror stories that have broken through to the media around pregnant people who have been unable to access care in medical emergencies and have suffered, horrific outcomes or in some cases lost their lives. And, as someone who works with physicians quite frequently, I can tell you that for every story that kind of breaks through to the media, there are so many stories that fly under the radar of people who are suffering under these bans. And then, like you said, it's not just abortion, and it's not even just, as some people call it, like elective abortion. It's medically necessary abortions, abortions where pregnancies are desperately wanted and, folks face a devastating fetal diagnosis. For example, here in Texas, we do not have an exception for fatal fetal anomalies. So folks are forced to carry that pregnancy or find the resources to travel out of state to get care. But it's also abortion, or I'm sorry, contraception. So threats to things like IUDs, based on kind of trying to redefine when life begins as being, at fertilization, and restrictions on IVF and other forms of assisted reproduction. Talk about restricting there's a lot of misinformation about whether or not Plan B and other emergency contraception are actually like abortifacients or drugs that cause abortions, which they scientifically and medically are not. But that doesn't, that's never stopped the anti-abortion folks from pushing that narrative, and really kind of gaining ground with it too. So yeah, it's pretty bleak, and I think we all hopefully know that the U.S. Has a pretty um, a pretty shameful maternal mortality rate. And, so many of our states have terrible maternity care deserts, particularly states that have large swaths of rural communities and counties. So this is all compounding that. And we're seeing physicians that are operating in states like Texas and others that have total abortion bans opt to move, or med students opt not to matriculate to those states. So it's also creating this kind of, downhill spiral where we're already have such a workforce shortage for physicians, and it's just going to get worse and worse in the states that need it most. So that is the bad news.
That's a lot of bad news.
Yeah, it's a lot of bad news.
In this context, you all, listeners, audience, everybody, just know that the United States of America is the only industrialized nation where more people are dying in childbirth rather than less. And that is in no small part because access to reproductive health care has been eviscerated. And it is really important to know, and I think this is important, that poll after poll shows the majority of people in the United States of America actually support the full suite of reproductive health care access and support decisions about family planning being made between the family, their physician, and their faith. There should not be politics, I don't think, and neither does the majority of people in America, in those decisions. It doesn't belong anywhere. And so sometimes we have just such a loud but powerful minority of people going after our reproductive rights that it could be like, oh, I might be the only one left in America who thinks that we need the full suite of reproductive health care. No. If you think that, you are actually with the majority of people in America. And just know we have some really loud, really unfortunately powerful people who are just stripping our rights to bodily autonomy and to being able to decide if, when, and how many children we have on our own. And because of that, we have more people dying in childbirth, more people being lost in the reproductive process, and importantly, we have fewer babies being born. We have some of the lowest birth rate that we've ever had. So it's a really big problem. And I also want to share that people's ideas of who needs access to the full suite of reproductive health care is often also wrong. Moms are the people who have 6 out of 10 abortions. And I have to share so many things. I'm on fire about this. Right now, we know that the number one way to make there be less abortions anywhere is access to birth control. And yet, the far right is going after birth control. I'm like, what in the name of hypocrisy is going on? So, what in the name of hypocrisy is going on?
Yeah.
What's happening?
No, I mean, it's a great question. And I mean, the right has been, kind of on this anti-birth control, anti-sex education train for forever, right? Like they're the primary voices pushing for abstinence-only sex ed, which is a obviously horrible way to prevent teen pregnancy. And, we know this from decades and decades and decades of it not working in any way. So yeah, no, there's a ton of hypocrisy in it. And I know, there's even hypocrisy in things like we've seen a lot of criticism from the right about women choosing to have babies later in life, after they've gone to school, after they've established their career, all of this. And yet for years and years and years and years, these same people have been told, like, don't get pregnant young, get your degree, get married, get settled, follow that kind of ABC life path. And then after doing it are now being criticized for having children later in life. So there is, there's hypocrisy all across the board. And I think, so much of it comes down to control. It comes down to controlling people's bodies, and not just in the abortion context, but kind of across, the spectrum. We're seeing all kinds of attacks on the LGBTQ plus community that are rooted in that same desire to like control people's bodily autonomy, their personal decision making, and kind of remove it from the individual, from their healthcare provider, and place it into the hands of legislators who have absolutely no idea what they're doing in the context of legislating medicine. So yeah, it's pretty wild.
Okay, so what can people do? We only have about 3 minutes and 50 seconds left. And you know what? We need a lot of happenings on this one. What can people do?
Sure. Yeah, no. It's a great question, and it's kind of a complicated one. So I'm gonna speed run it. So the first and probably least interesting answer is give to organizations who are doing this work. And I'm not just shilling for my organization, although if you want to go for it, but there are tons of organizations that are doing this work. And I think really, really importantly, give to your local abortion fund, give to the National Network of Abortion Funds. In the event that medication by mail is through some mechanism or another shot down, those are going to become more critical than ever. I think also, volunteering in whatever capacity feels right for you, feels joyful for you. There is unending need for it. Look up the organizations in your area or organizations that have virtual opportunities and go for it. And then I think another huge, huge, huge one, because you were saying, the majority of people do support reproductive freedom, and that is absolutely true. But people don't want to talk about it in their communities. And so I think, getting loud in your own community, whether that's your family, your friend group, your church community, your whatever it is that you do, and fighting disinformation with real accurate facts and science that we know to be true is so, so important, especially as we are coming up on a really, really important election this November.
Yes, 100%. So how can they find Lawyers for Good Government?
Yeah, so you can find us at l4gg.org. We're also on Blue Sky, although I'm blanking on our handle at this time. But the primary way is through our website. And then anyone who has specific questions can feel free to reach out to me directly.
And here's the important closing question. Ooh, I always like to ask this one. We talked about some very depressing stats,
Sure.
very depressing environment that's happening right now. What's giving you hope and keeping you going?
Oh, I love that question. Okay. What is giving me hope and keeping me going is honestly, and this is a cliche answer, but it's true, the other folks who are in this fight, because there are so many folks who are unbelievably passionate and unbelievably smart and strategic. And it is just a real balm for the soul to get to be in the rooms with those people and hear how many people are really thinking in such smart, strategic, proactive ways about how we can protect these rights and what lessons we can learn to make sure that they, that they're enduring.
Yeah, I mean, I also get hope from all the other people that are in this fight, all the people who are bravely sharing their stories and
Oh,
speaking
yeah.
out and, just keeping persisting with change and righting our ship of a country, which is definitely kind of sinking. And,
Mhm.
just not giving up on democracy or on bodily autonomy. Hello.
Yep.
And also, what gives me, I don't know what you call it, spark, is that my grandma, I've told this story a couple of times, right before she passed away, about a month or two before she passed away, 9 days shy of her 106th birthday,
Oh,
called me up and was like, hello, I would like you to know that I have seen some things, and I have seen us get more reproductive rights, and I see what's happening with us getting less reproductive rights. And she was like, please keep fighting, because I do not want my great granddaughters having fewer rights than I had. And I'm like, yes, we want to have more rights over generations, not less. And so
absolutely.
that brings me fire. Like, my daughter and my daughter's daughters and their daughters' daughters should definitely not have less rights than my grandmother. So
Absolutely.
that keeps me going too. Thank you so much for being on. I hope everybody joins, supports, follows Lawyers for Good Government. Thank you so much, Alyssa.
Thank you. Thank you for having me.
Thank you so much. Thank you.